So yeah, my goal today is to talk about what it looks like to f find your own path through this cancer journey. I have no financial disclosures. I'm going to start off with the very briefest basics of palliative care, which is what do we do as a specialty is we can see any patient that has serious illness, and our goal is to improve quality of life for patients throughout their journey. And we work alongside your other doctors for throughout curative treatments or at any point of their illness. And that includes the oncologist you're seeing here at Norris. And so what you see here on the right is one of our clinic flyers where we talk a lot about living well with illness and supportive care. So what do we actually do differently? Um, Most doctors focus on the diagnosis, which is incredibly important. That's why you come to USC to get the most up-to-date clinical trials and treatments. But in addition to those interventions, we talk about this concept of whole person care. That there might be physical symptoms you're going through that are really important to discuss and manage. Very importantly, there's emotional challenges that you're going through this journey, social changes. There might be some existential distress, and also just practical challenges of how to even get to clinic, work with doctors, and deal with the financial impact sometimes. So this whole person care is something that we try to do in palliative care, and we try to have a broader look at how our patients are doing. Regarding the unique challenges for the adolescent and young adult, I'll share with you here just a couple of points, but you're all going through it yourself and might have additional points you want to add to here. But I think all of us would agree that being a young adult is a time of rapid change and growing independence, and that's a really important part and really fun part about this age. Then there's also this developing identity and future goals, a focus on education, career, and relationships, and a desire to be as normal as possible, like just like every other colleague you might have. And that's the challenge with a cancer diagnosis is that it can stall some of these changes. It might be that um, you had moved out and have a job, but because of these treatments, you've decided to move back in to live with your parents to get additional support. And that step back can be challenging to cope with. Or it might be that you started college and then had to go on leave for a quarter or two in order to go through these treatments, and that could be a big change, or it might be a big strain on relationships. And so, to me, all this results in just a need to learn how to cope with changes in um, in your life and in circumstances that you're around. And but how do you do that? That's the main focus of my talk today, and also just what I do for my patients in the cancer center. So I'll be going into how do I even discuss coping and dealing with some of these changes I just brought up. The biggest shift that I want to share at the beginning of this talk is really that unlike um, the paradigm that you may be used to with doctors, which is that you come in with a symptom and get a diagnosis and then treatments, where the doctor prescribes something and ideally that problem improves. When it comes to emotional distress and coping, that may stem from uncertainty or a loss of control, and that will eventually lead to an impact in quality of life. But there's no quick fix for it. There's no prescription that a doctor can do to fix that. Instead, in palliative care, what we want to do is can we shift from fixing something to guiding, supporting, and partnering with you throughout this journey? Um, so that's just a big shift of what does that look like to guide and support someone? And the, in our specialty, we all approach things somewhat differently, but for me personally, I use a therapy method called Calm and Living Meaningfully that focuses on four domains. Um, One is to your relationship with healthcare providers. How is that trust and communication going with them? The changes to yourself and your relationship with close others. Uh, Maybe there's a question about the meaning behind all this and what your purpose should be now. Or there might be thoughts of the future and hope and mortality. And these are all important categories that might come up. And we try to explore all of these to help with coping. And throughout the rest of my talk, I'll be going through each of these four um, domains to illustrate what we can possibly do to help. I think the biggest thing that comes up when I first have a conversation with a patient is if I just ask a question of how have you been feeling? How has it been since the start of coming to Norris and going through treatments or seeing all these doctors? I think what I hear overwhelmingly is just the desire to go back to normal. And when I hear that word, it's so common and normal to want that. But when I hear those words, to me it's a reflection of this feeling that someone's identity is being changed, oftentimes against their will, that there's a loss for role that you might have, or independence, or sense of self. I mentioned earlier, this disruption of future plans and life trajectory. And this idea of being caught of, before I was like this and now I'm like this. Oftentimes the way I hear it is, I was always so healthy. How could this happen? And who am I now if I'm, with these changes? And these are all very, very real questions. Um, to me, when I hear these words, what I describe to my patients is that when there's change, this to me this is all part of grief. It's there's grief occurs with any meaningful loss or change, and it's not something that is only only when we're talking about end of life or death. It happens at any part of your life can have grief associated with it. And what you see here in the slide is just different aspects of what might lead to grief. It's possible that you were used to being a caregiver and now you're being a patient. That's a role reversal that can be very hard. Maybe you are a used to being the super parent I have listed here. I'm a parent myself, and you're used to doing a lot for your child, and so when that is reduced because maybe you're not physically around as much because you're going to patient appointments, that could be challenging. Maybe you were the breadwinner for the household, and now maybe you're either taking a break from that, and that could be a big change in your identity. And I mentioned earlier this idea of changing relationship dynamics, and that's a big pressure point for a lot of patients, or actual physical change in appearance is different. So to me, all this is grief. And when I talk about grief with my patients is that it's natural to want to go back to normal and kind of block these changes. But what I talk about is it's not about fixing it, but instead of walking with it. And so a lot of our discussions focus on you don't have to be strong and when it comes to going through these treatments, but how do you be real to yourself? How do you how can you eventually share your story so other people understand what you're going through and not feel pressured like you have to, not feel pressured to have to share until you're ready? And what does it look like to have rituals to help you process this grief? And for many people, they want to wait until they get through the uncertainty to start talking about it. But I really talk about what can we do now and today to help you take small steps. David Kessler is an author that wrote a lot about grief, and I really loved his quote where he states, "Grief needs expression, not suppression," and that's kind of a core part of how we help patients reflect on this identity change and how to walk with it. The next domain that comes up often is relationships with healthcare providers. I think for many of you all, it might be the first time you've actually had a a doctor's appointment talking about something serious. And what many patients may share with me is, I don't always know what's going to happen, or what to expect. I don't even know what questions to ask. And my parents or family are involved, but I want my voice to be heard. And what comes out of this is that there just might be a mismatch between what you're hearing and what's being explained. There might be a focus on medical details when there might be a big emotional component that needs to be addressed. And there might just be a feeling of having to make decisions under stress and uncertainty. And the way we help with this is as part of the team. What I do the most is I try to hear these concerns and I oftentimes try to help patients craft questions that they can ask the oncologist or the other providers that helps really answer the biggest concerns they might have. I think sometimes this overwhelming feeling, once we can help process it and kind of figure out where these feelings are coming from, then we can actually craft questions that can help the oncologist. I also can help um, really try to hone in on values that we can then communicate to the other providers that grounds them in knowing how to communicate with you all here. And so it can work with directly helping with conversations that you have, or with talking directly to doctors and helping them. So overall, this is generally viewed as a positive relationship of being another team member that you can talk to when there's confusion. The next domain is about this thinking about fear, hope, and mortality. And to me, a lot whenever we think about the future and uncertainty and worries, it leads to fear. Um, and what I have here on this slide is to point out that a lot of times fear is a bad thing. That fear is something that you want to avoid entirely. And but what I'm trying to illustrate in this slide is not that fear is bad or good, or something that is is something that we should get rid of, but it's actually just part of the cancer experience. And what I have here is that fear is a deeply human response to uncertainty, change, and potential loss. And it comes up even when treatments are going well. And this is the biggest thing I have to I tell my colleagues is that even when things are going well, your patients may have fears because if things are going well, there might be a fear of still the unknown. Is it always going to go well, or when anything's going to change? Or fear of suffering. Oh, is the next cancer treatment going to cause that nausea again? Or fear of loss, of like, when am I going to be able to return back? So it's that fear of uncertainty is something that is just an innate part of being human. We just always want to plan and think about the future. And so the main concept I share with my patients is they always want to run from fear because we don't we don't like fear. But how do you kind of channel it and turn it into something that is really just part of being human and part of going through any kind of change in our life? And so I'm saying all this in the setting of a cancer diagnosis, but as you can see here, uncertainty and change, potential loss is part of all living and growing up. And as a young adult, you're going through a lot of change and uncertainty. And as mentioned earlier, I'm a parent. Even as a parent, you're always fearing for your children. Like, are they going to grow up to be the child I want them to be? Are they going to always be as cute as they are now, right? So it's kind of a core part of just living life, independent of any kind of diagnosis. And so how we cope with fear is really what I talk to my patients about, is that a big part of the diagnosis and learning more is, well, some patients feel if I just gain as much information as possible and read everything about it, that will help me control this outcome. Or if I just try to be as positive as possible, it'll make things better. Or if I just ask as many questions as possible, maybe that, or seek multiple opinions, maybe that'll solve things. And so these are all natural things to do. And the one thing I'll point out is these strategies do help in the present moment, but they don't always ease fear in the long run. Sometimes it kind of create more fear the more you try to suppress it and try to solve it. And so what uh, Dr. Elizabeth Kubler-Ross and David Kessler wrote about, they have an entire book about the emotions about coping with um, with cancer, is they have a beautiful quote where they said, fears don't stop death, they stop life. And what they say here is that many of my patients, it can pull them out of the present moment, or it limits their connection, joy, or meaning, and it prevents them from living fully. I think a patient story I'll share with you is I had a patient that what she wanted more than anything was to get to her child's next birthday, and we succeeded in helping her get through that. And I saw her the next visit, and I said, "I'm so happy we got you through this goal of yours. Tell me how that experience was to celebrate the birthday with your child." And she said the entire time she was there, she kept thinking, well, this is it. I'm not going to be there for the next birthday now. And so this fear, despite having her achieve her goal, she wasn't able to come to peace with this idea that, there's always a future fear you can have. And so how do we come to peace with this is such an important part of this journey. So one thing I discuss with my patients is how do we shift our expectations? And this is a big way that I talk about mitigating fear, which is on the left here. So I categorize patients in one of two spectrums, actually one spectrum, about two sides of the spectrum. You're either the engineering type, where the feeling is you can control the outcome with enough knowledge, skill, and effort. And, and so that's the engineer type. And then you have the gardener type, which is the outcome can't be controlled, but you set yourself up for success as best as you can. You can choose the right soil, the right amount of water, the right amount of sunlight. But in the end, you don't really know how that plant's going to grow. You don't know how successful you're going to be, but you've done everything you possibly can do. And what I try to shift patients to is can we be closer to the Gardner type where you've done everything possible? You come to USC, you've done the best care possible, you've got a lot of support and you're on the right plan. But a lot of the cancer journey is just waiting then. And I'm saying this to the audience here that I'm sure you're all going through this is after you make the right decisions, the rest of the time is just waiting. And how do you live with your time then? And if it focuses on controlling the outcome, that's a really kind of hard place to be in because that's the part that no one really has control over. And so how we shift towards this direction of being a gardener is 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 the discussion I have with my patients, and sometimes that's viewed as a positive kind of shift in how they might view this part of the treatments. Um, Next is this idea of sense of meaning, and I think this is something that is I hear more with young adults than older adults. I'm not really sure why. I would love to hear your thoughts to this. But when I talk to patients about their journey, I do get asked often, why is this happening to me? You know, what did I do wrong, or why am I being punished? And I say what I have here in the slides. I say this is some people can get stuck in the search for meaning. And I'm breaking it down into two different types of search for meaning. There's one where there's a seek a attempt to get an explanation as to why something's happening, and there's an attempt to get orientation. So the explanation is the ones I just read. The orientation one is what still matters to me. What kind of person do I want to get through this, and how do I show myself compassion? And so there's a big difference here that I want to illustrate is that the why questions are actually really tough. Outside of cancer treatment, for any of you, you may have been in conversations before with friends that say that may have just had a breakup, and it's like, why did she break up with me, or why did he break up with me, right? That's a really hard question to answer. It could be a lot of things, and even if you get the answer, it might not actually make you feel any better. Oh, and when it comes to the cancer treatments, it might be, oh, well, there's a 2% chance that this happened, that it happened, right? And that's not like that's an answer, but it may not actually provide a meaning to it that they might be hoping for. And so that is just one of the biggest difficulties of how do we process this feeling of needing some answers and needing to find a purpose. And so the shift that I try to make, and this is also from David Kessler in his writing about finding meaning, is he talks about this idea of building meaning, not as opposed to finding an answer. And meaning is difficult when it comes to uncertainty. Uncertainty kind of forces meaning because you don't if you don't have a clear kind of next step, how do you ground yourself? And that's often through finding meaning. And that finding meaning comes through so at least in this slide, we talk about this idea that it could be showing up for the people that matter to you, or it might be finding moments of joy, or reflecting on who you are and what matters, and focusing on one step at a time to get through these difficult days. And so I list a couple bullet points here, but this is really the existential journey of just feeling that when there is unknown and when there's a lot of changes, how do you ground yourself and find it feels that there's a purpose? And that's something I list four things here, but there could be 100 things. It's individualized for each person on how they feel, what feels bring meanings to their day. So, yeah, so that's, oh, yeah, and so David Kessler has another great quote here where he wrote, we don't find meaning in the loss, we find meaning in us and what we do with the loss. And that's really this idea of how do you internalize what's happening and how to move forward with these changes. Okay. So the title of my talk was How do you find your own path? And so far what I've illustrated is that living well with cancer doesn't necessarily mean removing fear, grief, or uncertainty. They're part of the experience. And what we can do is one way is to find ways to stay connected to who we are, find what matters to us, and find what gives us meaning. And even in uncertainty, hopefully we can still continue to live, connect, grow, and build meaning moving forward. So I want to just share two patient stories uh, that kind of illustrates what I've shared here. And so I had a patient that's it's really special to me. She came to me and and she's a Norris patient. And after having had treatments for a year or so, she came to me because she shared she works in the fashion industry. And in that industry, I don't know anything about the fashion industry, but she shared that her hair was falling out and she wore a wig that looked really good. I couldn't tell she had a wig, but in the fashion industry, everyone looks at you. And she said people were commenting, "Oh, you've changed your hair. Oh, you got a haircut." It wasn't anything negative. It was just they comment on people's looks regularly. And what my patient struggled with is she didn't know what to do. She didn't want to lie and say, actually, this is a wig. My hair fell out. That's why I'm wearing it. But she also didn't want to divulge that she is going through these cancer treatments and going through this difficult journey to just everyone that, came across her work. And so this was a difficult struggle for her. The overall cancer treatments were going well. That wasn't the issue. It was just how do I maintain this important part of my life, which is my work and what I care about and not necessarily feeling as if I'm ready to talk about my cancer journey to every patient that comes across. And so we had a lot of conversations about this. Um, it started off with just her values and what's important to her. And for her, it's really being authentic and she doesn't want to lie. And then it came to like, who do you actually trust? Who's in your inner circle now where you can feel you can divulge this to? And this is where we kind of have this idea that when you're first going through these big changes, you don't have to tell everyone in the world. That's one way. But for many people, they might have one or two people they can be authentic with. And then maybe everyone else, you can have kind of some scripted lines of what you want to say about your treatments or whatever you want to say at all. But over time, the hope is as you feel safer with what you're going through and you feel like you've processed some of these feelings, you can be more open about talking about this. And over time, that inner circle grows. And so it started off for her with just her husband, and then eventually her one or two closest coworkers. And over time that grew to where she can have common language, where she can just share that if anyone brings it up, she can just make a comment and she doesn't have to divulge the whole story, but has something she shared. But that was our conversation. That was our conversation for many visits, just focusing on how she can live her life better by just being more at peace with her feelings. That came with her processing it and then learning how to communicate those feelings in that journey. So, so that was her. I have another patient that her biggest struggle is her. She came to me after having gone through cancer treatments for 7 years actually, and things were overall well. But the biggest challenge was how to include her child in her cancer journey uh, for most of for most of her journey so far, and this will probably resonate with any parents here. Parents want the impossible. They want their kid to have no change in their life. They want their kid to not worry about them, to just be a normal kid, to go through school, but they also want them as close as possible to them. They want them to they're going the parent is going through a lot of stressors and they of course they want people that they love nearby, so they want their child to be as close as possible. But how do you do that? How do you have your child be as normal as possible and not worry about you, and also have them be as nearby as possible to help you through your journey? I say many parents at the beginning of their journey, they just say, well, I'm just going to hide it all. And so we're just going to not tell them what's going on and have them just be a normal kid. But that eventually changes. And in this case, for 7 years, that's a long time to kind of hide that you're going through these treatments. And eventually your kid grows up and gets smart enough to like, Mom, why are you going to the doctor all the time? And why is this happening? And why is this happening? So at some point, there's this transition that parents talk to me about is, okay, I need to include them, but what does that look like? If I talk to them, they can get really scared. And so this is something I think is probably the most common discussion I have with my patients is like, how do we include family in our journey? And that's an important topic because what I haven't illustrated so far, when I talked about all this, walking with grief and talking about the situation is that it can be so isolating that even when you have people that love you and want to be there for you, but if you can't talk to them about how you're truly feeling, then you don't actually feel as if you can be real. And so that's the story here is how can you be real with the person you love the most? Maybe she loves her husband more or equally, but in this scenario, she talks about her child all the time. So how do you include your child here, the person you love so much? And so our discussion eventually becomes, okay, so how does that introduction look like? And and we handled it in a couple different ways. I offered to talk to the child directly to offload the medical details, and then she can focus on the relationship. And so she can focus on how much she loves him, including him, and any questions he has. He can join our visits and have his questions directly to the doctor. So that was something we offered. We also started, I recommended journaling, and so that he could share his thoughts and she could share hers. And that ended up kind of being the magic bullet because what she had thought was that he had no idea what was going on. But in this case, her son was a teenager, and of course noticed. And so he already had a lot of thoughts about her mom, his mom not being as involved in certain things, like going to games that he was participating in. And so once he was able to start sharing his thoughts, she kind of realized, oh my God, like he already knows kind of things are changing. I should talk to him about these changes and that they come. I'm not there because not because I don't love him, but because I have these other obligations. And once they can start talking about it, it actually became a really beautiful thing that what I share with many families is that even though you may have a diagnosis, everyone in the family is going through the cancer journey. And so and you can go through it together or separate, and everyone copes differently, but you can also support each other on how you guys cope differently. And so once we found an opening to talk about the different ways of coping, then there was, with a strong relationship, they were able to work through how to include each other, how to talk about things. And me as just one of the services, and you have the AYA program here, which is wonderful, is you can bring family in to be included in this journey and in different ways, whether that's a support group, through activities, or through the medical visits. And so that's the other story I just wanted to share that was also very meaningful to me and just illustrates just a couple ways we can really individualize what someone's path could look like through their journey. Okay,